Today, I'm going to talk about one of the most common procedures us urologists perform, and that's called a cystoscopy. If you're new here, I'm Dr. Rena Malik, urologist and pelvic surgeon. I make new content every Monday and Friday covering all sorts of things affecting urologic health, bladder health, sexual health, and so much more. So if you like what you see, make sure you subscribe and share this channel with your friends. Why do we do cystoscopies? Well, there's a number of different reasons, but the most common reason is if we see blood in the urine. And that's when sometimes your doctor will look at your urine in a dipstick and it shows blood, and then they send that urine off to look under the microscope to see if there are red blood cells in it, or if you see blood in the urine yourself. Those are both reasons to do a cystoscopy. Also, we can do them for a number of different reasons. If we want to assess the size of a man's prostate, assess the urethra for a woman, or the inside of the bladder, make sure there's no stones or other foreign bodies in the bladder. If we're trying to plan for certain types of surgery, or if we are surveilling your bladder for something like bladder cancer. And then lastly, it's usually part of many procedures that we do, like if we do a stent removal or a bladder biopsy, all of those require a cystoscopy. How do you prepare for a cystoscopy? Well, if you're getting a cystoscopy in the office, which is the most common place we do it, there's not really much you need to do. You do need to make sure you don't have any symptoms of a urinary tract infection, which would be like burning pain when you urinate, pain in the lower part of the abdomen, more urgency, like gotta go, or frequency of urination. Also, if you're on some sort of blood thinners, depending on what they're prepared to do during the cystoscopy, a doctor may ask you to stop those for some period of time before surgery. And blood thinners often include things like Motrin or ibuprofen, Advil, fish oil supplements, those sorts of things all can cause your blood to be too thin, so that if there is a procedure like a biopsy, you can have some significant bleeding if you're on blood thinners at the same time. Lastly, if you are super anxious, please talk to your doctor about maybe taking an anti-anxiety medication right before the procedure. If that is the case, we'll give you a medication that you can take an hour before the cystoscopy. You will need a ride to and from the procedure if that's the case. Once you get to the office, just know a cystoscopy, the whole process takes about 15 to 20 minutes. First, you'll be asked to empty your bladder, so go to the bathroom and pee, and then you'll be asked to lie down on a table, and depending on the type of cystoscopy that's performed, either using a rigid cystoscope or a flexible cystoscope, you'll have your legs up in stirrups for the procedure. They'll also insert some numbing jelly into the urethra to help with any discomfort that you might have during the procedure. When we do the cystoscopy, what happens is we'll insert the cystoscope into the urethra and directly into the bladder, visualizing it on a camera, either on a screen or through the eyepiece itself. After we are in the bladder, we start filling the bladder with some sterile saline or salt water that fills the bladder so we can look around on the inside. We do need to fill it so that it's full so we can see in between all the folds of the bladder and make sure there's no abnormalities. If there's going to be a procedure done, usually we'll insert some little tiny instruments through tiny ports in the scope itself that we can use to do a biopsy or pull a stent and then do that procedure. After we're done, we usually take the scope out. All that fluid stays in your bladder, and then you'll have to go to the bathroom and drain it out by urinating. So the question you're probably all wondering about is, does it hurt? Well, when you look at studies of people's pain after cystoscopy, when they use a scale of 0 to 10, you know, though you've seen those visual analog scale where they have the faces of how bad your pain is. So generally speaking, on average, men and women have pain somewhere between a 2 and a 3 on that 0 to 10 scale. And that's typically when we're passing the cystoscope through the sphincter, or the muscle that holds urine into the bladder, and that's typically when the pain occurs. So it's usually very, very brief, and then any pain that occurs after that is when just from the bladder being full and being slightly uncomfortable, feeling like you need to pee. However, there is a small percentage of patients who do have pain that is quite significant, above a 5 out of 10 on that same visual analog scale, and that's about 5% of people undergoing cystoscopy. However, that is exceedingly rare. I will say in the last 3.5 years, I don't think I've had to stop a cystoscopy due to pain, and typically most of the patients feel fine right after they get to urinate. What can you expect after a cystoscopy? Well, you can expect that you might have some discomfort when you urinate, kind of a burning pain for the first few urinations. You might see some blood in the urine. Not to be alarmed if there's blood in the urine, unless for some reason you're having difficulty urinating, you feel like you can't empty your bladder, or you're seeing big blood clots in the urine itself. Those might be signs that you might be having difficulty urinating and you might need to come in and see your urologist again or go to the emergency room. Lastly, some people are often surprised that they actually start peeing bubbles, and that's actually completely normal after a procedure like this. Other risks with any procedure are risk of infection, so in this case a urinary tract infection, and then injury to the bladder, the urethra, or the tubes draining the bladder. Again, this is very, very rare. If you're just doing a straightforward cystoscopy, those things are exceedingly uncommon. Things to see your doctor about is if you're having fever, chills, nausea, vomiting, and aren't able to really keep any food down. If you're having difficulties urinating, as I mentioned before, all those are reasons to call your doctor. And otherwise, typically most people get this procedure done and have really no major issues except for that discomfort urinating the first couple times after the procedure. I hope this is helpful to you. As always, remember to take care of yourself because you're worth it.